my first treatment plan would really be to manage it non-surgically, conservatively. Options for conservative management of ankle arthritis include just the usual things you might already try at home: ice and anti-inflammatories, activity modification, simply trying to avoid some of those activities that aggravate the ankle. But in a lot of cases, patients' problems will be more severe, and those simple issues or management options no longer work. What I can offer from my standpoint as an orthopedic surgeon is some more advanced treatments. Simple non-surgical treatments, as I said before, ice and anti-inflammatories, can move to the next step or the next level, which would include a cortisone injection in the ankle for one, prescription anti-inflammatory, something a little stronger than you might get over the counter, and the third option is a brace. There are a number of brace options. Some of them are simple off-the-shelf braces I can provide here in the office. Others I might send you with a prescription to have a custom brace made. And essentially what a brace does is immobilizes that painful joint, takes pressure off the joint, and allows you to do the activities you want to do despite having this underlying structural problem, which again is the arthritis. Of course, the brace and the cortisone injections and the anti-inflammatories don't change the underlying structural problem, which is a loss of that smooth gliding surface. And the only real way to alter that situation and really obtain a long-term result that works for both works for the patient can include surgery. And when we think about ankle arthritis, I'm really thinking about two major surgical procedures that I perform commonly. The first one would be an ankle fusion. If you look at the x-ray that I'm showing here today, this is a patient with fairly advanced arthritis in the ankle joint. The cartilage has been worn down. What we're seeing is really bone surfaces grinding on bone surfaces. This patient has what I would consider very severe end-stage arthritis, really the worst type situation. And this is a patient who I saw in the office. I started him on anti-inflammatories. He's had a cortisone injection or two. He's actually been in a brace for a number of months, but still is having pain and discomfort. So we sat down and talked about the options. I presented the two main options to him: ankle replacement versus ankle fusion. He chose ankle fusion, which I think is a perfectly reasonable option. It's effective in pain control. It's a fairly straightforward surgical procedure that we do a lot of and have done for the past 30 years in a very similar way. The benefit, again, of the ankle replacement is it can handle all different types of deformity, meaning an ankle that has a angular or bend to it, where there's bone loss, where there's been previous infection, where the patient may have other medical problems that prevent him from having the ankle replacement. And ankle fusion is really an effective and time-proven procedure. So here is a post-operative x-ray of the patient who had this ankle fusion. And again, you can see multiple screws that are crossing the joint. Essentially, what I'm trying to accomplish with an ankle fusion is to weld that joint into a single bone, to essentially take what is a painful joint that doesn't move very much in the first place and set that position so that we get rid of pain. He's effectively able to walk. And if you look at some of the studies that have looked at patients who have had ankle fusion, a lot of patients are concerned about their gait. How are they going to walk after this? What is their gait or their walk going to look like? And in fact, they walk much better after an ankle fusion because they're walking without pain, which is essentially the critical component here. So this patient did very well post-operatively. He is in a cast for roughly 6 to 8 weeks. Non-weight bearing, meaning he can't put weight on it initially until that fusion takes. But once the fusion takes, I can get that patient up, walking, returning back to his normal activities, walking for exercise, riding a bicycle, playing golf. We got patients doing all sorts of things on an ankle fusion and doing it very effectively.